All right. Good afternoon, everyone. I am here with Dr. White again. My name is Shyam Gautam. I'm from 24/7 Home Care, trying to do episode 2 of our coronavirus-related interview to the community. We are now on crisis time, but hope is coming on. The vaccine is coming nearby and knocking the door. We are talking about that as well. And Doctor, thank you so much for giving your precious time today.
You're welcome.
How are you doing?
I'm doing well. I think that given the state of the world with this pandemic, we're trying to get people to do all of the things that they need to do to be healthy and to keep them alive.
How are you operating your facility, understanding the current circumstances?
One of the things that I think about is still operational during this pandemic. One, we want to protect our employees, which are providing healthcare services to the patients. And so our employees, we do the daily checking of the fevers.
Okay.
The patients are triaged.
Sure.
And not the patients, but the employees are triaged twice a day.
Okay.
And so we do all of the things. We clean after the patients leave the rooms. We
Okay.
Clean the lobby. We clean to
Okay.
make sure that we're cleaning any viral material.
You still have a telehealth?
Still, we do telemedicine, and
Do you allow family members with patients now?
no,
Okay.
because we want to keep that. One of the things that we want to do is keep as many people. We want to get them in and get them out, so we don't want too many people in the room. That's one of the things with the social distancing. We want to make sure that we're being compliant and doing the best that we can for the patient.
The little hope is coming out. The companies are doing excellent job, especially Moderna or Pfizer, Biotech. Those companies are on front line right now to give us little hope and ease our breath now. I know the vaccination full implementation should be months away when ordinary people will be able to get it. Understanding the circumstances, the healthcare workers will get first and elderly, those are second, like that. You know that better. But what would you advise for general public right now until the vaccine is here? I know they are tired of.
Right, the mask and the
Yeah.
social distancing
Sure,
and
sure.
washing the hands, and I would continue to encourage that, but I would also encourage everyone that because we're in a pandemic state, I think that every person should there's a list of things that I think everyone should be on a daily basis: vitamin D, vitamin C, zinc, melatonin, and aspirin. Everybody, whether you have been tested, whether you've had COVID-19, there's people that have had COVID-19 and still are having symptoms ongoing,
Sure.
and so everybody should be on that concoction of medications, and also there's an antibiotic, doxycycline.
Okay.
Would also be a part of that regimen too.
Is that something proven or something people are experiencing good about it? Or
Those vitamins and that medicine that I listed are that people. It's been proven that people do better. Their immune system does better. This is a disease, a viral disease, that causes our immune system to go in hyper chaotic state, and so you get a inflammatory storm going on inside of your body, and that's why it's so hard to get this under control once it's out the gate.
Well, we are in this interview as of now 288,000 people died because of this virus. Our thoughts and prayers are with them and their families. Ohio is in number 7 top cases now.
Yeah.
Even the county where we are in, Franklin County, is in a red zone as well.
Yes.
And the situations are very depressing.
Yeah.
But we've been hearing about vaccination coming in, the president and our government saying that, and FDA approval is underway. But when are you expecting first phase of vaccine in Ohio?
It's hard to say because even when the vaccine arrives, who's going to get the vaccine first?
Yeah.
It'll probably be the essential workers will get the vaccine.
Okay.
Healthcare workers, and then I think by the time it gets to the lay person, it's going to be. I think it's going to be well into 2021.
2021.
Well into 2021.
Okay. As a frontline health worker, when are you expecting to put vaccine for yourself?
Well, as soon there's two different ones.
Is it before Christmas or after Christmas?
Probably after Christmas.
After Christmas,
Right.
okay.
Yeah. So we won't get the Pfizer
Okay.
because it has to be kept at a certain
Temperature.
temperature. And more than likely the vaccine that right now, and I'm saying this because it could change, but more than likely the Astrazeneca vaccine will be the one that we get.
Okay.
It can be refrigerated, and it's pretty safe. I've looked at the science behind that, and so far the safety and the efficacy of the Astrazeneca vaccine is pretty good.
Okay. Do you have any preference, or is that AstraZeneca that you are putting if you have a 3 choice of vaccines?
Well, I would do that without getting into a lot of science of
I
it.
know.
One is a messenger RNA, that's the
Yeah.
Pfizer, and the other one is a DNA, and they're both. They both have had a lot of research and science and studies and the safety profile.
Okay.
Both are really good vaccines.
I see.
And the reason why I would do the AstraZeneca one is because of the temperature and how it has to
Okay.
be kept.
I see. When we say that, are you 100% comfortable putting the vaccine for yourself?
I am 100% comfortable.
Okay. You encourage other people.
I
to-
would definitely encourage other people. That's one of the values of being able to have these kind of conversations.
Absolutely.
Where you can know that I've seen the kind of work that they've done with the DNA,
Absolutely.
how they spliced it out, what they did with that, and what the results were. How did the people do? And there have been people that have had the vaccine and they're doing fine.
So we talked about, I want to reinforce that again, is vaccine safe and effective?
So far, so good.
Okay, all right. That's what we want to do. Will insurance cover the administration?
Insurance will, I'm certain that if the vaccine is not free, that the insurance companies will definitely cover that.
They should cover, right?
They should.
So is your facility able to administer the vaccine?
We will, when it gets to the point where they will be giving it out to patients, as a primary care physician, we will be able to handle that.
Okay. Do you have anything to say about the vaccine, something that I did not ask?
One of the things that I heard, there was a patient doing an interview, and they were saying that after they got the vaccine, that they had some fatigue and the soreness of the vaccine, and they had headache. One of the things that I want people to know is that some of those symptoms are symptoms of your immune system kicking in. That when your immune system kicks in, you can feel fatigue, not to the point where you're just down, but you may feel fatigue for 1 or 2 days, you may have a fever, you're going to feel some soreness. So those symptoms that the patient was talking about we would expect them to have those.
नमस्कार दर्शकबिन, उहाँ हुनुहुन्थ्यो डाक्टर मार्क वाइट गेटवे फ्यामिली हेल्थ सेन्टरबाट एग्लर रोडमा हुनुहुन्छ कोलम्बसमा। हाम्रो समुदायमा विगत धेरै वर्षदेखि प्रख्यात डाक्टर हुनुहुन्छ। हाम्रो परिवारहरू हाम्रा कम्युनिटीमा उहाँले सर्भ गरिरहनु भएको छ। यो 24/7 होम हेल्थ केयरको दोस्रो प्रयास हो उहाँसँग इन्टरभ्यू गरेर तपाईँहरूलाई केही जानकारी दिने। हामी भ्याक्सिन पाउने क्रममा छौँ, भ्याक्सिन आउने क्रममा छ र त्यसको बारेमा उहाँसँग केही डिटेल दिएको थिएँ मैले। उहाँले भन्नुभयो 3वटा कम्पनीहरूले अगाडि छन्, मोडर्ना, फाइजर र एस्ट्राजेनिका। उत्तिकै इफेक्टिभ छन्, उहाँले पनि लाउनुहुन्छ र सबै समुदायले जब तपाईँहरूले पाउनुहुन्छ भ्याक्सिन लाउनु होला, किन सन्देह नराखिकन। 2टा डोज लाउनुपर्नेछ भ्याक्सिन। सायद अर्को वर्षको पहिलोमै आउँछ होला भ्याक्सिन भन्ने कुरा गर्नुभयो। भ्याक्सिन सेफ छ, तपाईँलाई त्यस्तो कुनै समस्या हुने छैन। इन्सुरेन्सले कभर गर्ने ठुलो सम्भावना छ, यदि फ्री भएन भने इन्सुरेन्सले कभर गर्छ भन्ने कुरा गर्नुभयो र उहाँको डक्टर अफिसले पनि यो भ्याक्सिन उपलब्ध उहाँहरूले पाइसक्दा उपलब्ध गराउँछन्, तपाईँहरूलाई लगाइदिन्छन् भन्ने कुरा गर्नुभयो। र आइनो अहिलेसम्म तपाईँहरू टायर्ड हुनुहुन्छ, धेरै भयो, यसरी सेफ मास्क लगाएर बस्नु भएको, एक्स्ट्रा सेफ हुनुभएको, कतै नजानु भएको र अब अन्तिम घडीमा कृपया आफ्नो नजिकको मानिसहरू नगुमाउनु होला। धेरै केसेसहरू बढिरहेछ। ओहायोमा नम्बर 7 छ, फ्र्याङ्कलिन काउन्टी नम्बर 1 मा छ। धेरै समुदायका मानिसहरूलाई भाइरस छ। कृपया स्वस्थ रहनुहोस्, मस्त रहनुहोस्, हवस्। नमस्कार, धन्यवाद।